Hi, my name is Brian Jones, and today we're going to be going over a lesson plan utilized to teach the junior or sophomore level nursing students the disease process of asthma and how to best care for a patient with asthma. All right. So, good morning, class. Today we're going to be going over the disease process asthma and how to actually take care of your patients with asthma, some of the common treatments, and some of the things that you might see while you're taking care of these patients. So, today, throughout the course of this lecture, you're going to learn about how to, you're going to be able to describe the signs and symptoms, comorbidities, and the risk factors for asthma. By the end of this lesson, you're also going to be able to explain the pathophysiology with asthma within the human body. And after completing this lesson, you're also going to be able to describe the most common treatments that we have for patients with asthma. So the first thing we're going to look at is going to be the background of the disease. So exactly what are we looking at? Okay, so the prevalence within the United States is roughly 8.4% of the population. And the average annual prevalence is slightly higher in children at 9.5%, and then in adults, we're looking at about 7.7%. And also, one of the things of note is that the prevalence is actually higher in those of lower socioeconomic status, and we actually see an increase in prevalence as the socioeconomic status decreases. Now, when a patient presents with asthma, some of the most common signs and symptoms that we're going to see are going to be those of a cough, an acute shortness of breath, a tightening of the chest, and kind of the telltale sign is going to be the expiratory wheeze rather than the inspiratory wheeze. So the expiratory wheeze is going to be the thing that should really clue you in that this patient is suffering from asthma. Some of the contributing conditions are going to be rhinitis and sinusitis, GERD, OSA, and some hormonal changes in different patients within the population. Some of the comorbidities, especially after long-term asthma, are going to be decreased lung capacity, and also even with short-term asthmatic patients or new asthmatic patients, we're looking at an increased risk of pneumonia. So what are the risk factors for developing asthma? Number one is age. As we mentioned, children are more likely to develop asthma. Genetics. Asthma is actually has a very strong genetic component, and so parents pass it down to their children. And we're going to look a little bit more about that in the pathophysiology portion. Um, Also, the environment that you live in. So, any extra exposure to harsh chemicals, smokes, any kind, whether it be tobacco smoke, factory smoke, um, fire smoke, whatever it may be, that does increase your risk. And then, as we mentioned, as the socioeconomic status declines, the risk of asthma or prevalence of asthma increases. As far as testing to determine, whether a patient has asthma or just an acute, upper airway or lower airway exacerbation, then we look at, unfortunately, there's no gold standard for testing for asthma. But some of the things that are used are spirometry, lung function testing, measuring the nitric oxide output, and then also the methacholine and mannitol challenges that could be administered by a pulmonologist. So exactly how does asthma work? What does that mean in the body? So when we look at this, we're going to look at the pathophysiology of allergic asthma, which is the most common type of asthma. Okay. Now, when I mentioned that the parent passes the genetic propensity down to the child, it's because of a particular antibody called immunoglobulin E or IgE. And this patient, once they have this gene, their body actually produces the IgE antibody in large numbers. And the way that happens is the T cell differentiation is actually skewed or shifted to where they produce B cells that then produce the IgE antibody rather than the normal IgG. And the reason why that's important is because the IgG antibodies have a very high propensity or affinity for attaching to mast cells and basophils. And what happens when they attach to these mast cells in numbers as high as 500,000 is they attach. And then when an antigen enters the body, be it whatever that may be, so um, a, a bleach fume chemical or a ragweed or whatever one of the person's triggers is, whenever that enters, the IgE antibody wants to bind with that antigen as well. And when it reaches out to bind, if you will, that to that antigen, it actually tears the cell wall because it's already attached to the mast cell. Now, when these mast cells rupture, they release several different components or chemicals, but the ones that we're really concerned with in this process are going to be histamine, and then even more importantly, are the slow reacting substance of anaphylaxis. So the chemicals released, again, specifically the slow reacting substance of anaphylaxis, cause that bronchospasm, the increased edema, and also a highly increased mucus secretion within the lungs. Now, repeated attacks over time cause airway remodeling, specifically a mucus gland hypertrophy and increased vascularity. And what that's going to lead to is a patient who continuously has higher levels of mucus within their lower airways than a patient without asthma, as well as continuous increased swelling. And as you can imagine, the complications that lead to. Now, how do we treat a patient with asthma? So let's look at some of the common treatments. Before we look at the medications, we kind of have to break them into a short acting and a long acting. So in the acute phase of an attack, probably the most powerful and common thing that we have to combat this is going to be the oral or IV corticosteroids. They're very effective by reducing the swelling within the airways. However, they do act systemically and cause quite a few side effects. So we cannot use these for long periods of time. And that's what makes them not a good choice for long-term management. But they are very effective in the short term. We also utilize short-acting beta agonist medications, and they work as bronchodilators by relaxing the smooth muscle of the airways. And in addition to these two, over the last, I would say, 10 years, one of the ones that's really gained popularity has been a medication called Atrovent, and it works by blocking the muscarinic receptors within the muscles surrounding the airways and helps them to relax and prevent that constriction. So the long-term management of or medications, also known as the management medications, include inhaled corticosteroids, and these can be either through a metered dose inhaler or a nebulizer. And how they work, again, same way as the short-acting ones, is by reducing the swelling in the airways, and they are actually very effective when used regularly over a long period of time. We also utilize leukotriene modifiers, and the way those work is by blocking the actions of the leukotrienes, which prevents excess mucus secretion and tightening of the airway muscles. And then we add into this the long-acting beta agonists, which work the same as the short-acting, as bronchodilators and relaxing the smooth muscles of the airway. Now, some patients don't respond well to any of these medications, and those patients, unfortunately, are left with a surgical option, and that is called bronchial thermoplasty. And in that, a pulmonologist or surgeon passes the electrode inside the lungs and superheats it. And what happens is it actually destroys some of the smooth muscle within the lungs and surrounding areas, and that leaves you with less muscle to constrict. But you can imagine the side effects and how that can, honestly, is a very extreme measure. So as nurses, how are we going to help our patients to live with asthma? Well, the single most important thing that we can tell them is to completely avoid all forms of tobacco. Avoid all forms, even secondhand smoke, okay, is not okay, because that is a well-known significant trigger for all asthmatics. Also, the next thing that we're going to help them do is going to be to identify their individual triggers, whether that be ragweed or bleach or dog dander, or whatever it might be. We have to identify those triggers and help them to avoid them. And then finally, we need to encourage them to always utilize their maintenance medications to where we're able to decrease that swelling and mucus production over time. Okay, so does anyone have any questions? All right, so at this time, I'm going to just pass out a short 5-question quiz. No worries, it's all multiple choice and true false. And if you would, we're just going to pass them back up. And I'm just trying to make sure that everyone got the information that we needed them to get for today. Well, I greatly appreciate everyone's attention and participation, and I hope you all have a great day.